So tonight, thank you for joining us for this expert webinar. Tonight we're going to be concentrating on separation anxiety and transitions. It's always at this time of the year when we find that we're thinking about our children starting either nursery or school with September coming. I'm going to find this really interesting. I was speaking to Roxanne beforehand, and my past is I was an early years teacher for many, many years. So I have seen the importance of transition and what a difference it can make to not only the child, but the family and even the teacher. And it's so important to think about those things to put in place and get those relationships with staff and clear communication for such good transitions. So I'm going to be watching with avidly as well, Roxanne. So we have got Roxanne with us this evening. She's got a plethora of experience and qualifications, including she's a qualified emotional wellbeing practitioner. So I'm really, really thrilled that we can hand over to Roxanne and let her start the webinar. Just before I start, if anyone has any questions, guys, if you pop them in the chat, as you've been doing already, or in the questions and answers, I will monitor that as the session goes on. And at the end, we'll present those all to Roxanne if you've got something you'd like to ask her. So good evening, Roxanne.
Thank you. So a little bit about me. So as Lorna has mentioned, today's training session is around preschool separation anxiety and those thoughts and feelings and behaviours that may potentially come up. So a little bit about me. My name's Roxanne. I'm a trainer with the London School of Childcare Studies. So this is one of the roles that I do. I also do training as well as emotional support for young people and children. I also deliver training around supporting children and young people with their mental health. And I also do some distance learning tutoring. So I tutor adult learners learning about various topics, including children and young people's mental health, working with children and young people with special educational needs, and also working with children who may present with distressed behaviour, which can feed into also about separation anxiety. That's all part of that as well. So today's webinar really is just to kind of support parents and carers of children in the early years with some practical techniques for managing separation anxiety during the child's transition from nursery and school. So it's really important, really, to address separation anxiety for a smooth transition. And if you do notice with your children that there might be an issue coming up, it's really important that it is kind of paid attention to and addressed, because addressing separation anxiety is really important for a smooth transition from nursery to primary school, as it greatly impacts a child's emotional well-being and social development, and in the longer term, their academic success. So separation anxiety, really, it just kind of refers to the distress experienced by young children when separated from their primary caregiver or a familiar environment, so like the home environment, for example. So by understanding and addressing the anxiety, there's several benefits that can be achieved by that. So addressing separation anxiety allows for that establishment of a secure emotional foundation. And in turn, when a child feels secure and supported during that transition, they're more likely to develop a positive attitude towards school, build trust with their teachers, and form healthy relationships with their friends and their peers. So this emotional stability provides a solid basis for their future learning and overall development. So if you think about having a house, for example, when you build a house, you can't just build a house on any type of foundation. You can't build it on mud, for example. It might not stand still for very long. You have to build a really solid foundation. And in terms of a child's education, but also their emotional development, that's also really important. It's really important to build a strong foundation, and it will really support their development as they grow older. In addition, addressing separation anxiety, it helps to foster independence and resilience. So by gradually exposing children to separation situations, such as starting nursery or school, and supporting them to build those coping strategies, they'll learn to manage their emotions and adapt to new environments, such as starting school. So when they are able to adapt to those environments, it helps to build their resilience. It also helps to enhance their self-esteem and their confidence, and it equips them with the skills needed to face challenges throughout their school career. And in addition, addressing separation anxiety promotes active participation in the learning process. So if a child is feeling less anxious, they're feeling happier, they're feeling calm, they're feeling safe, they're more likely to kind of engage in their classes and their learning at school. So when children are not preoccupied with, if they're not worrying about how they're feeling or what might happen, the fear of the unknown, where are they going, if they're being taken to school, if they're not worrying about those things and they feel calm and they feel safe, they can fully engage in their classroom activities. They can concentrate on the task at hand and therefore build their positive learning habits. So, and again, that kind of sets the stage for a smooth transition through their academic career and enables them to make the most of the educational opportunities that are available to them. So really, just to kind of quickly summarize that part. So addressing separation anxiety during the transition from nursery to primary school is really important for fostering emotional well-being, promoting social development and supporting their academic success. And so by creating a supportive environment and providing appropriate strategies, children can navigate the challenges of separation with confidence and feel good about themselves, which therefore will lead to a positive and successful transition. So a little bit we've already kind of mentioned. So as mentioned before, separation anxiety is distress experienced from young children when they're separated from their primary caregiver. That could be parents, carer, grandparents, whoever kind of helps with their primary caregiving, or their familiar environment. So if you think about a child who may be at home from birth, they haven't attended nursery or anything, and then all of a sudden they're being moved into school, that's going to be a really, really it's an unknown environment. They don't know the environment. They don't know the people. It's going to take time for them to feel safe and calm and comfortable in that environment. And as a result, if a child is experiencing separation anxiety, some of the what we call I suppose the behaviors or the manifestations we might see are things like they might be really crying quite a lot. They might be quite clingy onto their parent or their carer. They might start throwing tantrums or throw themselves on the floor, throw toys around. They might refuse to attend school. Or you might notice physical symptoms as a result of the anxiety. So things like complaining of having a stomach ache or a headache. And it's not saying that they're not having a stomach ache or a headache, but they're so anxious that the worries are now starting to, I suppose, manifest in a physical way. And also as well, for some children, they may also be worrying about the caregiver when they're separated from them. So they might be worrying if they're in school, they don't know where they are. They don't know where their parent or carer is. They might be worrying, are they okay? What are they doing? Are they going to come back? So this is why it's not uncommon to see the behaviors as mentioned, because if you think about a child, especially if you're thinking about the early years, so we're talking about under 6 really, they're not going to have the emotional literacy to tell you how they're feeling. So for some children, that may manifest more so in their behaviors. So when you see these behaviors, especially ones that I suppose traditionally will be seen as naughty or disruptive, think about behavior as communication. So if you see in a child who looks like they're really kind of struggling to adapt, it's about thinking about what might they be feeling, and you might be able to do some activities with them to help them to explore the thoughts and feelings they're having. But of course, it depends on the age of the child as well. So some of the underlying causes and factors that can contribute to separation anxiety, some of these things you might have heard of before. So if you think about a baby, so around the 6 months of age, babies may start to show signs of anxiety when their parent or caregiver leaves. They might start to become clingy or start crying, and that's a really normal aspect of development. But by the age of around 3, they tend to kind of grow out of that. However, separation anxiety can sometimes indicate that children are recognizing their reliance on their caregiver, and they're gaining an awareness of their surroundings. So they feel comfortable and secure in those environments that they know and the people that they know. So in situations where they feel less secure, so it might be a new environment or they've got a new caregiver, so it might be their school teacher or a nursery teacher, or even if it's a case where their caregiver is not nearby with them in an unfamiliar environment, that's when they might start to feel really, really anxious about it. So for babies, losing sight of their caregiver can be really quite distressing sometimes, as they're very young, they're babies, they don't know that, you know, mum or dad or whoever the person is, they're going to come back. You know, they may fear permanent separation. So when toddlers are separated from their parents or carers, they may see it as being left behind in a sense, and you know, may potentially question, are they going to come back for me? But as a result, with I suppose with time and with support and with love, and once they start to learn that mum or dad is coming back at the end of the day, if they're at nursery, for example, when they start to learn to cope with those separations, when they're, like I say, when they're consistently feeling loved and understood and supported and comforted by their parents or carers, they will start to be a bit more kind of relaxed about it and find going into unfamiliar environments a bit easier to navigate, because they will start to learn and have that understanding that someone is going to come back and get me. Mummy is coming back, daddy is coming back. But it's important to really kind of note that the intensity of separation anxiety will vary amongst children. So some children might be really, really anxious and they might need a little bit more time and a little bit more support to be able to settle down into their new environment. And there's some children might need a little bit of support, a little bit of a cuddle every now and again if they're not feeling too great or they're a bit anxious about it. But it will vary, like adults, like how adults are children different, children are different too. And so we've talked about intensity, and the levels of separation anxiety can also vary. So some young children may initially get upset when their parents or carers leave, but they're able to then engage and play with other children or other toys, etc. But as mentioned, some might find it really, really difficult. And in some cases, that the known or the more so conventional methods of comfort may not necessarily work for them. In some certain circumstances, the fear of separation can become so intense for the child that what you might notice is the child might become quite hypervigilant. So that they might constantly keep an eye on their parents or carers' whereabouts, or if they're in their classroom, every time the classroom doors that opens, they're looking to see if it's their mum or dad come back. So or it may be a case of when parents are trying to drop them off for the day, they don't want them to leave. They hang on to their trousers or their clothing. So in such cases, the child may struggle to enjoy like things like playtime or social interactions without their parent or carer being there. But however, that might be a more kind of intense situation or a more rare case. But really, it's the response that, you know, how children tend to respond to quite anxiety-inducing situations like that transition from nursery to school, etc. As they get older, you might find that the anxiety it lessens, because as part of that growth and that development, they do learn how to manage, and how they do start to learn and manage their anxiety. So the impact of separation anxiety on the child's emotional well-being and their adjustments to new environments. We look at that now. So separation anxiety can have a significant impact on a child's emotional well-being and their adjustments to new environments. So the intense distress that might be experienced during separations can therefore lead to increased stress levels. So they might feel much more stressed out. They might feel very insecure and feel quite vulnerable. And in turn, that can affect their overall emotional well-being, which then can lead to them potentially feeling quite sad or really finding it difficult in regulating their emotions. So they might feel sad or angry or upset or withdrawn, and they might find it difficult to kind of get out of that because they're feeling so anxious. As a result of it, of their anxiety, it might also hinder their ability to adapt to their new environments and also form secure attachments with people such as their caregivers, so like their teachers at the time, or maybe engaging in play or social interactions with their friends. So it's really, as mentioned before, it's really important that social anxiety is addressed where possible, and because obviously if it continues for a long time, it can then develop into an anxiety disorder, which we really don't want for our children. So it's important to promote it's important to address it, to help to promote their emotional resilience, help them to feel more secure in their environments, and also to help facilitate their successful adjustment to new environments, to help them to be able to manage or to cope when they're in new environments, because of course no one stays in the same place all of their life. There's going to be situations as we go through life, from young children right the way up to adulthood, where we might have to go into new environments, meet new people. So the earlier that children and young people can learn those skills and those strategies, how to manage that, it's going to be really, really beneficial to them throughout their life. Okay, so now I've got a really, really short video, just gives a bit more information. It's from the Child Mind Institute in the US, and it just gives us a bit more information about what separation anxiety is and how it can impact on our children. So I'll quickly stop sharing this so I can then share the video again. Hopefully that will all work away. It's really short. It's less than 2 minutes long, so you should be okay.
It's common for young children to have trouble separating from their parents or caregivers, but children with separation anxiety disorder have such extreme fears about being apart that they can really get in the way of daily life. For example, a child with separation anxiety might have trouble concentrating in class because they're so worried that their parents or caregivers might get into a car accident while they're at school. Kids with separation anxiety often miss out on activities like sleepovers with their friends and sports. They might even refuse to go to school, or if they do go, call home repeatedly for reassurance that their parents are okay. They might also cling to parents at home or be too worried to sleep in their own beds. Sometimes kids will get anxious even before the separation happens, like getting a nervous stomachache days before a parent is going on a trip. If this sounds familiar, getting treatment can help. Treatment for separation anxiety disorder involves both the parent and child attending therapy. Parents can learn how to set boundaries with their children and support them with exploring the world on their own. Children can learn skills to deal with scary thoughts and feelings and practice separating a little at a time. Most kids with separation anxiety get a lot better with treatment, especially if their anxiety is caught early.
So that was just a really quick whistle-stop tour about what might be expected with separation anxiety, and she is talking more about potentially older children and giving examples of different situations where sorry, I didn't share my screen, jumping ahead, different examples of where a child might feel really, really anxious and the behaviors that might present in that. So it's about, kind of, like I say, paying attention to kind of behaviors. And like she said on the video, if caught early, that's the best situation we can have. If it can be caught early, we can help the young person to get that help that they need, develop those coping strategies and skills, so therefore it doesn't develop into a much bigger problem that might be harder to kind of work with or take longer to remedy. So if you find that your child might stick to you, close to you in social situations, or have shown signs of anxiety about starting preschool, maybe consider taking specific steps to prepare them for their first day. So while you might think, it might be a case of where someone might think of avoiding the topic of school will reduce their nervousness, children who want to know what to expect in certain situations and practice routines are more likely to feel a sense of stability. So if you are able to prepare them, even if it's weeks in advance, I remember when my son was young, I had a calendar and was preparing him for, he used to like to sleep in bed with me. Okay, so when he was getting a bit older now, and I was like, okay, now you can't keep sleeping with mummy, you're getting bigger now. So what we did was, I remember at the time, there was about 3 weeks before, I think it was his birthday, I can't remember which birthday, I think it was like 6. And so we put on the calendar and I said, once you turn 6, you have to sleep in your own bed. And each day, as each day passed, about 3 weeks before, we would kind of cross off each day before bed. So when the day actually came for his birthday and we agreed that he'd now sleep in his bed, he was okay with it. It was me that was anxious and worried that he might come into my bedroom at night, but he didn't. He stayed in his bed and it worked really well. So if you are able to just find some time, if you can, like a few days or weeks before, whichever works for your child, just to kind of talk to them about what school is, what's going to happen, find out, it depending on the age of the child, find out if they've got any worries or any concerns. And in some schools and some nurseries, what some of them do, they actually allow you to come in and have a visit beforehand, before the child can see the school, before the child starts school officially. So if you can, discuss with your child what a typical school day will be like, from the morning routines to activities, or even the meals, because in some schools, children don't eat their meals in the classroom. They might have a dinner hall that they go to eat in. So talk to them find out what you can from the school so you're able to talk to your child and prepare them. So, visit the school before the first day if possible. If you're able to, take a tour, spend time at the playground, read books about starting preschool if that's available to you also. Okay, and it can also be helpful where possible if you're noticing that your child is developing anxiety about starting school. If you're able to, it could be helpful to inform your child's teacher about their separation anxiety and how it might present in terms of their behaviours. And teachers, especially teachers working with the early years, are really experienced in handling such situations and can offer really valuable advice. So if you can, schedule a meeting to discuss your concerns before school begins. Also, research indicates that skilled teachers can make the transition to school easier for anxious children. And, the teacher may potentially suggest strategies that could help, such as engaging your child in specific tasks upon arrival and providing rewards for attendance, for example. And it can sometimes be like really simple things like, in the morning they might have one or two children. Once they've done the register, I mean, it might be very different now, I'm sure it's all electronic, but when I was going to school, they did the register and then we took the register to the office. It might be something different, but even though just having that kind of routine, they kind of know that they might have a job to do in the morning. It might be sorting out the colouring pencils. That can also help to breed familiarity, which helps them to stay just I feel a bit more calmer because they know what to expect. They know when they come into school, they know what the routine, they know what to expect. If possible, if you can arrange a play date with some of your children's new classmates before the first day, that might be helpful because familiar faces at preschool can help your child feel more comfortable and at ease. When I think back to going to school, especially going to secondary school for older children, there was always that kind of worry do you know anyone from your primary school who's going as well? Are they in the same class as you? Because you want your children to have that familiarity. If possible, consider allowing your child to bring what we call a transitional object to school. And that can be something really small, such as a small stuffed animal, a photo or a drawing on their hand, something that makes them feel comfortable. So those kind of familiar items known as transitional objects can help to minimize where possible any kind of separation anxiety. And they provide like a close sense of closeness when you're not present. Or it might even be something like you might give them like a hanky or something with like your own perfume or your fragrance or something on it, so they can still smell you and feel a bit calmer. And it's not something that they may need for a long time. They might only need it for the first few days or the first week or couple of weeks of starting nursery school. But it's all of these kind of different tips and strategies that can help to make the process a lot calmer for our children. Where possible, gradually expose your children to short periods of separation to help them practice coping without you. So it can be really, really brief intervals and then gradually increase in the duration. And for example, it could be running an errand or going for a walk while someone that your child is familiar with stays with them. So, you might say, okay, mummy or daddy's just going to the shop. Here you're going to be with grandma, granddad, friend, sibling, whoever the case is, someone that they know. And so, you go to the shop for 10-15 minutes and you come back, just kind of start getting them used to situations where you may not be there all the time. And then, as time goes on, you can progress to play dates with close friends or even a full day at a relative's house if or when they're ready to do that. So all those kinds of experiences as well will help the child to develop that understanding of being separate from their parent or their caregiver, and that it's not permanent. You will be coming back. If you have got a special goodbye routine, if you can establish one, that would be really great. So, rituals can be really, really comforting. So creating a unique way of saying goodbye when you leave them at school each day, as maybe like a secret handshake, for example, a special saying, or maybe, a specific type of hug, and that can help them to feel a bit more settled and secure. So practice the routine during periods of separation. It could even be when you're putting them to bed at night time. You might do your little secret handshake before going to bed. All those kinds of things again can help with that familiarity and just feeling a bit more kind of comforted. Okay. Effective communication. It's really important that where possible we communicate with our children in a way that they can understand as well. Because if there's an uncertainty or a lack of understanding, that can often contribute to separation anxiety. So making communication clear in a way that that's child friendly and in a way that the child can understand can be vital in supporting your child. And that may not necessarily always be in the traditional verbal way. It might be a case of drawing pictures, or you might read a book about starting school or nursery, or watching a cartoon or something with them, and just having those conversations where possible. Or even for the child, they might prefer to do drawings or something to kind of express how they're feeling. But it's about having that communication. And it's really important to provide children with information about their experiences and the reasons why they're potentially feeling that way. Because it helps to kind of normalize it, but it also helps them to have realistic expectations of the new situation and start to understand why they're being separated from their caregiver. So it's about being like really transparent with our children where possible, about what's their situation, why they're starting to go to school. They're getting older, it's what happens. And if they are expressing feeling nervous or anxious, normalizing it, that it's completely normal, it's understandable. You're going into a new environment with new people. It's completely understandable that you're feeling a bit worried about it. Sometimes as parents, carers, humans, we sometimes shy away from discussing such matters with children because we have that worry ourselves that it may distress them, when in fact taking the time to talk and help them understand actually helps them. It actually helps the child to feel more familiar with the situation. So when they do actually start going to nursery, or they do actually start going to school, and certain routines start happening, like taking the register in the morning, that's usually the first things that schools and nursery do, just to make sure everybody's in. They'll having the routine of maybe sitting on the mat or sitting on their chair. If you've spoken to them about that, they'll start putting the dots together. So they'll remember that, mum or dad or grandma, whoever spoke to me about this, and it's actually happening. Like, so what they've said is actually happening. So that can help with them feeling a bit calmer. But again, also explain to them in an age appropriate manner the specifics of when and why and how long the separation will occur, as well as when you will return. So you don't have to be necessarily specific about I'll come and pick you up at 3:00 in the afternoon if that's the time school finishes. It might be a case of at the end of the school day, find out from the teacher what the activity might be at the end of the school day. When I think about children of the early years, they might have had a little story or something. So you can say to them, if that's the last activity of the day, you can say to them, well, I'll be there for you to pick you up after story time. So then they know that after story time, you're going to be coming back for them. But of course, communication, as mentioned, it's really important to be age appropriate and in a way that the child can understand. So here's some examples of phrases and techniques you can use when addressing a child's separation anxiety and concerns. And these are things that you might find helpful. So there's some examples. So about acknowledging and then validating their feelings. So you can say something, like, I understand that it can be hard to be away from mummy or daddy, and it's okay to feel a little scared or sad. We can talk about it if you want to. That's some examples. Providing reassurance and comfort, just reassure them that you'll always come back to pick them up, and reassure them that their teacher is there to look after them as well. You'll tell them, your teacher will take good care of you whilst I'm away. And the stuff that you're probably already doing, letting them know that you love them very much, you're always thinking of them. And at the end of the school day, when you pick them up as well, have those conversations, ask them about what they did at school. What happened with at school that day? Or if you know that there's an activity coming up later on in the week, when the activity passes, remember to ask them about it. How did sports day go today? All those kind of things. Offer explanations and set expectations. So again, talk about the when and the why. So, you're going to school because it's a place where you can learn and play with new friends, or, during school time, or reassuring the child where you will be, when you're at school, I'll be at work and we'll see each other again in the afternoon or later on in the day. Always encourage open communication. So, reassuring the child that they can talk to you about what's going on for them, or, if they do seem quite worried or anxious or scared, or, reassuring them that they're not in trouble in any way. Let's talk about it. And also as well, reassure them whilst they're at school. If you're worried or you miss me, tell your teacher, and they're also there to help you. So, or if they said they felt sad or lonely at school, keep the communication open, talk to them about why they might be feeling that way. But again, it needs to be age appropriate and not like an interrogation. So it's just kind of like a conversation rather than trying to drill down to why they're feeling upset at school. As we've mentioned, you know, practice separation in a gradual manner. So it could be really short play dates with a friend, or even in your house, even in your home, it might be a case of, you know, you might say, you know, your child might be playing in their room or playing in the living room with their toys. And you might say, okay, I'm just going to be in the kitchen, starting dinner or whatever the case is. So they know that you're still around somewhere, but you're nearby. You're not going to be far away. Creating, as mentioned, a goodbye ritual or like a some kind of special goodbye technique, and involving your children in the process. And what we mean by that is things like packing their school bag. You can ask them, you know, what do you want to put in your school bag? Or if they want to take a toy, like a transitional object, allow them to take that toy as well. Or, you know, I'm sure we do this a lot already, and let them pick their outfit for the first day if possible. And it might not necessarily mean, you know, you give them the range of the whole wardrobe. You yourself might pick out 3 or 4 appropriate outfits and let them choose from those 3 or 4. So they actually have a stake in the whole process of getting ready for school as well. And focus on the positive experiences. So at the end of the school day, or when you pick them up, you know, talk to them about what was the good stuff, what did they like doing, what made them excited, or what did they like to play with, or what was a fun activity. Try to focus on the positive stuff. I'm not saying you should ignore any negatives or how they're feeling, but where possible, what we call being asset focused. Focus on what worked well for them. But again, as mentioned earlier, every child's going to be unique. So it's really important to kind of adapt these strategies and techniques to suit their age, their developmental stage, and also their own individual needs. So it's really about providing consistent support, reassurance, and open communication can help to address their separation anxiety effectively. And it's about being consistent with it as well. So we've already talked about some of this stuff already, so we can implement them. So gradual separation has been mentioned. Establish a consistent routine. Consistency is really, really important when supporting a child or a young person with feelings of anxiety. It's about being consistent with it, because also on those days where you feel they're having a really, really good day, they haven't been as anxious, still be consistent with your techniques, because what you find may happen if on a good day you're not you know, engaging in that conversation as much, or you're not reassuring them that you're coming back, or you're not reassuring them that they can go to their teacher for help. In their little mind, they might start to get confused. How come mummy or daddy hasn't said that? They might not understand what's kind of going on, and that's when those behaviors might present again, those feelings of anxiety. So it's about really being consistent, even on the good days where it seems like they're doing really, really well. Continue with, you know, if they say to you they don't want their transition objects, by all means, don't force them to take it, but still continue, let them know that it's there in case they need it. So we've talked about consistent routine, allowing your child to bring a transitional object. Depending on the size of it, they can keep it in their school bag. If it's really, really small, they might keep it in their pocket, knowing it's always with them. And it can be really helpful because it can serve as like a tangible and actual physical connection to their caregiver, and it helps to provide that sense of security. As mentioned, communication is really important. You can use things like visual aids as well, as I mentioned about using the calendar. You can use a daily schedule or a calendar to help your child to kind of understand when you won't be with them, if it's at school or nursery. But also discuss your plans with your child where possible, of course, using simple language and clear expectations, and just remind them that you're going to return and pick them up. So just reassure them that you will be coming back. Staying connected, which kind of means really establishing a communication routine to stay connected with your child where possible. In some cases, if a child's really upset or distressed, the school maybe allow you to speak to them on the phone just to kind of reassure them that everything's okay. But obviously each setting will be different, so you need to speak to the school. And as mentioned, keep the communication positive and supportive, offering encouragement and praise, focus on what's working well. You can play pretend separation situations. Like, it's really common for children to kind of play like pretending games and role-playing games. So you can do that with your child as well. Pretend play situations where your child pretends to leave and then comes back, or vice versa. And just these kind of role plays will help them to develop those skills and to support them to feel safer, and that they're going to be in a safe and familiar environment. And familiarize them with a new environment, as mentioned. If possible, go to the school, and if they're able to meet the teachers, and encourage your child to ask questions, not only of yourself, but also their teachers and stuff at school as well. Ask them to ask questions and to ask for help or express any worries they might have. As mentioned, lastly, about the positive reinforcement, just acknowledge that, and praise them that they've done really, really well. And especially at the end of that school day, when they've managed to get through a whole day, praise is going to be really, really important. And just kind of reinforce how well they've done. And then hopefully as time goes on, it should get a bit easier. And so, managing those kind of anxieties at drop-off time. So once you've kind of done your preparations using some of the techniques suggested, or you might have others that you've devised for yourself, you've worked out for yourself. So once you've done those preparations, it's time to kind of face the start of school. So the first initial days or weeks can be really challenging, even for children who may not necessarily experience or present with separation anxiety. But some of the strategies that we've mentioned can help to make the transition as smooth as possible. So it's about having have a positive attitude. So if you remember that children kind of learn from us as adults, they take their cues from us. So it's really important to stay positive and composed, even if you yourself inside are really worried. Try to, where possible, avoid showing that your child's separation anxiety is also worrying you. Smile, remind them of the great experiences they will have at school, and the learning and the fun that they will enjoy at school. So where possible, try to have that positive attitude. But at the same time, as mentioned earlier, acknowledge and validate their concerns or their feelings. It's, reassure them that it's really normal to be quite nervous. And you might find it helpful, or that your child might find it helpful, if you share stories of your own childhood anxieties. It can help you to connect with your child, and your child will also know that you were also a child once, and you also went through this as well. So it can help you to connect with your child. But also they will be able to see, and you'll be able to demonstrate that, with, the worries that they have are normal, but you can actually overcome them. You can actually get past them. Where possible, have a smooth goodbye when it is time to drop them off at school, using the ritual that you might have practiced, or the goodbye technique you might have practiced, and reassure your child that you'll return soon. And then leave. If you can, after that, then go. It may feel insensitive at the time, or it may be really, really hard to kind of leave them when they might be crying or really pleading for you to stay. But sometimes actually lingering on and going on for much longer can actually impact on the situation. It might make it a bit worse. It prolongs that anxiety. So where possible, if you can avoid prolonging the leaving, or just giving one more minute, it can because if you prolong it, it can sometimes create a false impression that you might be able to stay, and you're not going to be able to, especially if you're hesitant yourself. So it can feel really difficult, but it is about, say your goodbyes, reassure them that they've done really well, your hugs and kisses and your ritual that you've come up with, and then you need to kind of hand them over to the school or the nursery and then leave. And I can appreciate it will be difficult, but as time goes on, it should get easier. And you remind yourself, you're teaching your children to build up these resilient skills. Where possible, at the end of school day, if possible, be punctual to pick them up. If in the afternoon before picking up your children, if you've got some time to yourself, or you go and do errands, it's not uncommon to sometimes lose track of time. I remember once when my child was young, and I had a couple of hours, and I thought, I'll just lie down for half an hour, and then I'll get up and get them. And next thing you know, I had the phone ringing. The school was like, "Are you coming to get him?" So yeah, where possible, try and be punctual. Try and be focused on picking them up. So it's about just ensure that you arrive on time, or if someone else is picking up your child for you, that they arrive on time, or even early. If they can get there like 5 or 10 minutes early, if the child can see them through the glass window, they're going to feel great if they can see that whoever's picking them up is there. Because that feeling of being late can really heighten anxiety, and it may potentially impact on the next day when you have to drop them off again. It might be even more challenging than the first time, because again, it's that consistency. It's really important to be consistent, because that will help to maintain a kind of smooth transition. Whereas if it's a bit not so consistent, not so smooth, it can actually raise more anxiety in the child. So again, by applying these strategies, you can help to ease your child's separation anxiety and just help things go a bit smoother. Okay, so this is now really kind of working with your child's nursery or school. So building a positive relationship with a nursery or school staff is really important to support the child's transition and to therefore minimize any separation anxiety. And this is for a few reasons. So the first one is trust and comfort. So a positive relationship with the child's nursery or school can help create a sense of trust and comfort for your child. And when they see that their parents or carers have a good relationship with the staff, it reassures them that they are adults that they can trust, and they can also be connected and supportive of each other. And then the child may learn to trust them more because they can see that their parents or carers do too. As mentioned previously, about having that consistency and continuity. So having effective communication and collaboration with teachers and nursery staff can ensure a really consistent approach to addressing separation anxiety. So you're kind of working together. So working together, sharing information about the child's anxiety when they're in school and outside of school can allow for parents and carers, or the nursery and the school, to come together to make a plan on how to support the child. And that will be a plan of how to support them in school and at home, because it's going to be really, really important that in both of those environments their anxiety is supported, because they're only being supported at home but then they're going to school and they don't have much support, or vice versa. They're gonna start going through lots of periods of anxiety, and long-term anxiety can be really unhealthy for anybody, adult or child. So working together with the nursery or the school to kind of minimize and support things to be a bit smoother is really important. It's vital to understand the child's needs. So teachers and staff who have a positive relationship with the child's parents or carers are more likely to have a deeper understanding of the child's individual needs and concerns. And that's because you're going to be always communicating. I know in my work, some schools and nurseries have like diaries that they write and send home with the children each day. So that could be a helpful technique. And same for the parents. They might write about how the child was the evening before going to school in the morning, and they'll give that to the teacher. So if they've had like a really difficult evening before bed, or they've woken up grumpy, for example, the teacher will be aware that they've woken up quite grumpy. That's something to kind of be aware of. Or, if they were being resistant to going to school. So having that kind of relationship and understanding, it will help not only yourself as parents and carers, but also the school staff to provide appropriate support and put strategies in place to try and ease their separation anxiety. But also the teacher and the school and yourselves would be aware of how to approach the situation to suit the child's specific requirements, to support their specific needs. Oh, teeth in. Okay, so shared strategies and techniques kind of does what it says on the tin, really. So collaborating with the nursery or the school staff, it helps to share effective strategies that help to manage anxiety. Again, as mentioned before, you can talk about what's worked well at home, and teachers and staff can give professional advice or expertise and experiences from either similar situations, but they can also advise on what was going well at school. So it's really important to communicate with your child's teacher, but also school as a whole, really, as well. So some tips for effective collaboration with teachers and staff. So having that open dialogue, open and regular communication with school and nursery staff to discuss the anxiety that the child may be presenting with, share any relevant information about the child's fears or any kind of triggers, for example, or previous experiences and discuss strategies that have been effective at home. Because if you've established a strategy that works really well at home, the teacher might be able to replicate that in school. So if they're aware of it, if they're not aware of it, they don't know when to use it. They don't know how, or that it works. So if you have a really good strategy, communicate that to the school as well. Where possible, attend parent-teacher meetings and school events, and that will also help to build relationships with the staff and the teachers and help to stay informed about the child's progress and any changes in their behaviours and needs, because a child's behaviour and need is not going to stay static. It is going to change as time goes on and as they start to grow older, and as we know, children grow really quickly, so having that continual conversation is really helpful. As mentioned, they get to share updates and any changes, so you can keep the school staff informed about any significant changes or events in a child's life that may impact their separation anxiety. And that could be situations in the family, could have moved house recently, there could have been, something that's happened within the child, like a bereavement or something. So it's about keeping the staff and the school updated. And asking for support and advice as well as parents or carers. Don't hesitate to seek guidance and support from the nursery or the school staff. They will have a wealth of experience dealing with separation anxiety. It's a pretty common thing, and they can provide you with really valuable advice or resources, or even help to refer you to additional services if it's felt needed. As mentioned earlier, establish those consistent routines. So work with the school staff or nursery staff to have consistent routines between home and the nursery or school environment, because consistency is what helps the child to feel secure and provides a sense of predictability. If they feel like if what they've been prepared for actually happens, it's predictable, they know what's going to happen, they feel much safer. And again, that can help to reduce separation anxiety. Think about all the things that you would like as an adult. Can you imagine if if you left your house in the morning and your usual routine was to leave the house, to go to the train station, to get the train somewhere, and the train station was suddenly closed, no notification, no nothing, you're going to be like, what's going on? You're going to be really confused. And think about that for our children as well. They're going to be really, if they don't know what's happening, if there is no predictability, there is no routine, it can be really, really worrying and anxiety inducing. Always review progress and make adjustments if needed. So regularly reviewing the child's progress can be really helpful in managing their separation anxiety, because you then make sure that they're getting the appropriate support. If they're becoming less anxious, but you're still providing the same level of support before, it might potentially not work. It's not going to work anymore because the child's not as anxious. They might not need as much support. So having that regular kind of reviewing and making adjustments, that can help manage, offer the child support that is actually relevant for them, and it is helpful for their needs. So discuss any adjustments or changes that might be necessary with the school staff or the nursery staff, and ensure that everyone is aligned and working together to support the child's well-being. So as kind of mentioned, the theme through this really is by building positive relationships with your nursery or school staff. It can and effectively communicating with them and working with them in a collaborative way. And parents, carers and caregivers can work together with the staff to understand and address the child's separation anxiety, and therefore creating a more supportive and nurturing environment for successful transition. Though of course we would all love our children to just go into school or nursery and just happily sit down, and some children do, but for some children it's just really kind of difficult for them. So it's about managing that effectively. Okay, so this is a bit more information about when it might be a separation anxiety disorder. So if it is a concern, and it might be a separation anxiety disorder. So as mentioned, many children experience periods of separation anxiety during their toddlers or preschool years, and it can often be linked. It's not uncommon for it to be linked to new events, such as going from nursery to school, or stressful situations potentially at home. But for some children, if separation anxiety persists, even if the different strategies are being used, if it's not getting any better, and if it persists for weeks or even extends into months or even years in some cases, these may be the children that belong to the percentage of children, a very small percentage of children who develop anxiety disorders. So separation anxiety disorder is typically diagnosed when children display one or more of the following behaviours persistently for 4 weeks or longer. So it has to be kind of like persistently ongoing, everyday, frequent sort of thing. So it could be intense distress when away from parents or loved ones. So as we mentioned, intense distress might be being really clingy, really crying, really struggling to focus or settle down or do any task, and they're just constantly worried. They may be excessively worried about the safety of loved ones. They may want constant reassurance that they're okay. They want constant reassurance that they're coming back. They may actually really worry about their own personal safety as well. In some cases, they're not familiar with the environment, so they don't feel safe. They might worry that something might hurt them or harm them in some way. They may have difficulty leaving the house, which also includes going to school, but also, doing, if you've got to run some errands and take your children with you, they don't want to go, they fear of leaving the house. That could be a potential sign. But like I say, it's got to be persistent for 4 weeks or more. If that's happening, that's when you really need to seek medical professional help. Sleep difficulties. Sleep difficulties are not necessarily uncommon for some children. Some children do have sleep difficulties, but again, if it's persistent or if they're showing that they're experiencing physical symptoms of illness when they're away from loved ones. So, you take them to school, on the way to school, they're saying they've got a stomach ache or a headache, or in some cases they might be vomiting. I used to work with a young girl who, when she felt really anxious, she would literally faint. Like she would get that I don't want to go into detail here now, but it's about the autonomic nervous system. For her, when she was really heightened in anxiety and really worried, she would literally pass out. So every child's symptoms will be different. But if there's if you observe any of these symptoms in your child, it's advisable to speak to your doctor, or they may then potentially refer on to a pediatrician or a psychologist. But these professionals can evaluate and assess whether your child has had any traumatic experiences that may be triggering their anxiety. And they can then discuss, therapies or any other help that you may be able to implement, or they may be able to actually support with as well, so that your child can develop strategies to support to help to kind of, I suppose, alleviate their fear of the unknown or fear of being separated. But like I say, if you notice it's going on for persistently for a long period of time, so about a month or so, definitely seek help or support from a professional. Usually the GP, so your doctor, is usually the first point of contact. It might be different in different countries, but I know in the UK our first point of contact is the GP, who then can refer to other services for help. But you're not on your own. That's the thing, is you're not on your own. There is help available. So I'm really conscious of the time. So just to summarize a bit. So addressing separation anxiety, as we mentioned, is really important for a smooth transition from nursery to primary school, or from nursery or from home to preschool, and it greatly impacts the child's emotional well-being, their social development, and academic success. But by understanding and addressing the anxiety, it can be really beneficial to the child. So addressing separation anxiety allows for the establishment of that secure emotional well-being and social development. And when children feel secure and supported through that transition, they're more likely to develop a positive attitude towards school. They'll work on building trust with teachers, and they can form healthy relationships with their friends. And it's really important, because this emotional stability then provides a solid foundation for future learning and overall development. It will be beneficial for them, not only in their early years, but as they grow older. And addressing separation anxiety, it helps, as we mentioned, it helps their development, but also it helps to foster independence and resilience. And independence and resilience, especially resilience, that is one of those skills that we have, so that when we're going through difficult times, and that's throughout our life, it helps us to kind of move forward from difficult times. It helps us to kind of deal with what's happened. We can process it and we can move forward. Resilience is a really important kind of skill to develop, and not all children are going to be instantly resilient, because it is something that's kind of learned with time. But it's important that they learn those skills so they're able to develop them, and then they'll be able to cope in new environments. And it's important to address separation anxiety because it helps promote active participation in the learning process. So children are more likely to be engaged in actual learning because they're not preoccupied with the worries that's on their mind. And in really separation anxiety during the transition from nursery to primary school, it's dealing with it, managing it and working through it it's really important for fostering that emotional well-being. So we want our children to be happy in school, we want them to develop socially, and we want them to develop academically and do well. So it's about, you know, we can't ignore anxiety. It is something that needs to be addressed because then they'll have a much more smoother transition and have a much more happier and positive school life. So for yourselves as parents and carers and professionals, self-care is really, really important. So if you're working or supporting a child who has separation anxiety, self-care is absolutely crucial because it helps you to look after your own well-being and manage your own stress levels, and you can be better equipped to provide the necessary and support and stability for the child. So you need to be the best person you can be physically and emotionally to therefore provide stability. So taking care of yourself allows your parents and carers to approach the situation with patience, resilience, and having a positive mindset, which then in turn positively impacts the child's experience and their ability to cope with separation anxiety. So if you're calm and if you're zen and if you're working through it and you're helping your child, then the child's more likely to be receptive to that because it's a much more a calmer exchange. So some examples of self-care activities that you can engage in. These are just some examples. You know, everyone has their own kind of things they like to do. You know, prioritize your rest and sleep. Make sure you're getting enough rest and quality sleep where possible, because sleep's really important in terms of managing your stress levels. Reach out to friends or family if you need any emotional support, or there might be support groups that can help to provide understanding, empathy, or just someone to listen to, really. You know, sharing your feelings and concerns can help to alleviate your stress levels and provide a much more valuable kind of perspective. Get other people's perspectives. What did they do? You might find it really, really helpful. Engage in relaxation techniques. So practice relaxation techniques, deep breathing exercises. If you're into like meditation or yoga, anything that you find that helps to reduce your stress and promote emotional well-being. Maintain a healthy lifestyle. So, you know, eat nutritious meals, have regular exercise, and it doesn't have to be, you know, lifting huge weights, like sweating every day. It could just be something really simple, like going for a short walk. But that's also really important for stress levels. And, you know, prioritize your self-care activities that make you feel happy and make you feel relaxed. Find that time for yourself too. Setting boundaries, so allowing that time and space for your self-care. So that might be setting aside a couple of hours per week for you know, you might have a hobby or an interest that you want to take up, but it's about just looking after yourself as well. Practicing mindfulness. So those things, you know, to help you stay present and focused. Again, it could be things like breathing exercises. It could be journaling at the end of the day, so you can express how your thoughts and feelings, get them out of your mind. But anything that kind of helps you to have mental clarity and feel happier. If needed, please do not suffer in silence. Please seek help if needed. And like I say, you can speak to your GP and they could refer you on to like therapists or counsellors who you might want for yourself, but they can also provide guidance and support and help you to develop those coping strategies to manage your own emotions and stress levels. And some of those strategies that you might learn, you know, they could be adapted so you can also teach your child to use them as well. You know, connect with others, you know, maintain those social connections, speak to your friends and your family, engage in activities that help you to feel happy, spend quality time with your loved ones. All of these kind of things all go into promoting self-care. So it's about remind yourself, you know, self-care is not something that's selfish, but it's really important. It's essential for your own well-being and the well-being of your child that you're raising or you're looking after or you're supporting. And by prioritizing your self-care, you can also then approach the challenges of supporting a child with separation anxiety from a place of strength and resilience. If you're not feeling if you're not feeling your greatest, you might really struggle to be able to support the child in the way you would like to. So it's about looking after yourself too. This is just a few signposts into different organisations that might also be really helpful. Anna Freud is the child's mental health service. They're based in the UK, but they have a really good informative website that you're more than welcome to have a look at for lots of different information and videos and things. Of course, for the UK, there's the NHS. Again, they provide lots of help from psychologists and various other mental health professionals that can help with children and their anxiety. But like I say, over here, we have to go through GP. There's Very Well Family, which is that they have a really, really good informative, and they have lots of peer-reviewed journals on various issues that may impact on families. They've also got Very Well Mind as well. If you check those out when you've got time, really, really good resource. And in the UK, again, is Young Minds. And this is a service specifically for children and young people who may be experiencing mental health issues. And you may be able to access their website as well from outside the UK. So you're more than welcome to have a look at that for extra resources too. Okay. We're now at the end. Sorry, I feel like I've been talking at you guys. So if anyone's got any questions, I'll stop sharing so you could probably see me better then.
Thanks, Roxanne. That was really, really good. So much information.
Yeah, lots.
Like I say, I think it's important that you do reach out for help, isn't it? Please, there was them self-care slides at the end, because I think sometimes parents put so much on their shoulders, don't they? Actually, if you can just reach out and speak to even the teaching staff and things, they're all there to support you.
Yeah.
So we have got a message from a vet, and she's put, can these strategies be adapted to help smaller children under 3 years of age with their separation anxiety when their nanny arrives and parents have to leave?
Yeah, I would say they would. I mean, some of them won't be suitable, not for a little one under 3, but it is about for little ones under 3, it might be a case of you just have to adapt it to what's more suitable for their age. So it might be or it might take a bit longer to support them with their separation anxiety. But if you just have a discussion with the nanny, you know, you guys could probably both come up with strategies that you can use together. So the nanny uses those same strategies when they're with the child, and then you use them when the child's with you, and then hopefully that will help relieve their anxiety a bit. Or even if possible, before if you can, the nanny might be able to spend like a few hours or over a couple of days with you and your child together, so that there is that familiarity, they get to know them. So when there is time that the parents then leave, they know the nanny, they will probably be much more comfortable with the nanny. But yeah, I would say some of these strategies you can definitely use with little ones, but it's about adapting them that's suitable for the child's age and age appropriate. So you might use more kind of like toys and things as part of it, rather than having a discussion like you might do with, like, say, a 5 or 6 year old.
Brilliant, thank you. That's great. Like you say, it is constant communication. I remember when I was teaching, when we actually got to the bottom of why little girl was so anxious, it was simply because she couldn't do with the hustle and bustle of 30 plus children coming into a classroom at the same time every morning. So it was as simple as working with the parent, that she came in 5 minutes later every morning.
Yeah.
She felt so much better, and then eventually she started realizing, oh, hang on, I'm missing out on what they do at the beginning of the school day. So then she's quite happy then to come in with everybody else. So it's just in that way. We've got Andrew, who has put, what about toddlers moving back to a new parent in a fostering scenario?
Oh, that's interesting.
Yeah, very interesting.
So I've taken my headset out, so I'm trying to put a light on.
Yeah, I'm the same actually. All of a sudden the light's gone down, hasn't it?
Okay, hang on. So, but yeah, that is a really interesting one, because for children who are in the foster care system, they might not have regular so sorry. Yeah, they might, a bit too bright. They might have they'll have lots of changes going on. So they go into lots of different they don't have the stability, so that's when it can be really quite difficult. So for a child, I would imagine, who's in the foster care system, there may need to be a strategy that's been discussed with the foster carers, or the social worker needs to be really kind of aware. They need to work with the child to find out what the potential triggers might be for anxiety, and all of those sorts of issues, so that if the social worker is aware of what works for the child, if they do need to go to a different foster carer, they're able to actually discuss those strategies with the foster carer, and discuss the importance of being consistent with those, because it is going to be very difficult for children who might be in a fostering situation. If they're in a long-term fostering situation and that initial anxiety and they settle down, that's going to be fine. But if it is one where it might change quite frequently, which in some cases it can, that's where it might be a bit more difficult in terms of managing their anxiety, because there'll be other factors that are going on. So the little one might be they might really struggle with settling down, because they might then start to learn that I'm going to move on anyway at some point, if that makes sense. So it's a bit more of a challenging situation, but that is a really, really good question, because it is not uncommon to see separation anxiety for young people in care, which I used to work with children in care. It wasn't uncommon to see not only separation anxiety, or it went the other way. They had to move around so much, not so much little ones, but older ones. They moved around so much that they became quite withdrawn, and they didn't really engage in their environments or the people around them, because they start to learn, I'm not going to be here for very long. There's no point. So that is a really good question. And I wish I could wave a magic wand and give a straightforward answer, but it is one of those things where it's about trying different strategies to find out what works well. And then once you've established what works well, it's got to be consistent with that, and have effective communication with all trusted adults who's involved, really. I wish I could give a much more kind of definitive answer, but it is one of those situations that's quite difficult.
Thanks, Roxanne. I think that was really useful. Like you say, every child's going to be unique in every situation, aren't they?
Yeah.
That's brilliant. So we've had loads of messages as well saying thank you and how helpful and informative it's been. Great advice. So it's brilliant. Emily says, thank you, great advice. I have 3 children with selective mutism, and it is a huge challenge.
Yeah.
And then we've got, so that's I think everybody. So thank you very much. That was brilliant. You will those of you who are attending tonight, you will be emailed the presentation, so you'll get to see the slides again. And if you do have any questions when you leave, if you just email the college, then we can again get in contact with Roxanne or myself to try and answer those. So thank you very much for joining us tonight. And thanks, Roxanne. I really, really enjoyed it.
Oh, thank you.
Yeah, it was brilliant.
Thank you, everybody.
Thank you for watching our video. For more London School of Childcare Studies content, see our social media or visit our website childcarestudies.co.uk.